I know that we're not seeing as many patients as we would expect through our A&E department at the moment, but we're also seeing a lot less patients being referred by GPs for patients with suspected cancers. They get referred to us on what is called a 2-week wait pathway, where you get seen within 2 weeks and your condition assessed and then tests organised if necessary. And in fact, what's concerning us is we should still be seeing the same number of these patients as we would usually. So I'm going to talk to some of my colleagues about why that might be so. Now I'm talking to Ms. Sue Downs, and Sue Downs is one of our breast surgeons and the clinical lead for our breast services at the James Paget Hospital. So Sue, what kinds of patients we're not seeing in the same kind of numbers that we used to see?
So normally we would ask any ladies who have breast symptoms such as breast pain, breast lumps or any discharge from their nipples or any other concerning symptoms to contact their GP and to be assessed for referral into the breast clinic. Unfortunately, due to COVID, we've seen a large reduction in the number of patients coming up to see us and to be referred to the breast clinic. So we would encourage that any ladies who have any concerns about their breasts should contact their GP as normal.
And what will happen once they contact their GP and they go and see their GP or have a telephone consultation with their GP?
So normally at the GPs they would be examined by the GP or a nurse practitioner. That may not happen at the moment due to COVID. However, they will still be referred into our service. One of the consultants in breast surgery will triage the referrals and we would decide whether we need to see them face to face and have some imaging done at the same time, or whether we can have a telephone consultation to assess their symptoms. However, all referrals will still be seen in the breast service and assessed. If a patient needs to come to the hospital, they can be assured that we are located in the safe green zone of the hospital at the back of the James Paget. All of our staff have been trained to undertake a specific PPE to protect themselves and the patients when they are seen face to face. We've also spaced out our appointments to ensure that patients do not come into contact with other patients when they are coming through the service, and they should follow a one-way circuit to minimise any contact with other people.
Thank you, that's very helpful. On a different question, what's happening to the patients who were undergoing breast screening in the past? What's happened to that service at the moment?
So we would normally undertake breast screening for ladies aged between 50 and 70 every 3 years. Now, due to COVID, regionally breast screening has paused. Breast screen detected cancers usually account for about 1/3 of the cancers detected. We are keeping a very detailed database of all the ladies whose screening appointments have been delayed, and we will be recalling them for screening as soon as it is deemed safe enough for them to undergo the screening and for the vans to be cleaned effectively between appointments.
So if one of these patients who you've seen through the appointment system needs surgery, what happens then?
So if a patient is deemed to need surgery, we would undertake the operation in our daycare dedicated facility. Patients would be asked to self-isolate for 7 days before surgery. They would also attend for a COVID swab approximately 48 hours before surgery, and surgery would only proceed if the swab was negative. We're undertaking the majority of our cases still here at James Paget, but also some cases in the private sector to maintain that pathway as well. As I said, patients generally undergo day case surgery, so they don't need to stay in the hospital for any longer than necessary, and would be able to go home the same day with full instructions about their care.
Thank you. So now I'm going to talk to Mr. Kamal Ariel, who's one of our colorectal surgeons in the hospital here. So Kamal, could you talk to us about what the bowel symptoms are that are really worrying that patients should still be going to see their GPs about or calling 111?
So if they have got bleeding from the back passage, and if there is abdominal distension, and if they have felt a lump in the tummy, they still need to go to the doctor.
So if their GP then sees them and will take the history and understand what's happening, and then decides they do need to have a referral to the hospital. What happens when that referral then comes into the hospital? What do we do with it?
So those patients are referred as a 2-week wait with suspected bowel cancer, and those referrals are seen by the consultant, and they are either the patient is either telephoned or they have a video consultation.
Okay. And the video consultations we're doing, you're able to talk to the patient and see the patient, and they're able to see you?
They are, yes. So the patients will be able to talk to us, explain their symptoms so that we can clarify what the symptoms are like, and also we'll be able to see them at the same time face to face. We won't be able to examine, but having had the history taken and explained, that gives us a lot of idea about the patient.
And then you may decide, obviously, that some investigations are needed. So what investigations are we doing at the moment, and how are those done?
In the past, before COVID started, we used to do a lot of colonoscopies, but now instead we have been doing more of CT scans. That is mainly because the risk of acquiring the COVID with the CT scan is much lesser, and that can pick up the cancers if there is any.
And I understand in the hospital at the moment we have different CTs. So we have a CT which is specially kept for COVID patients, and what we call a green CT, where we're putting other patients.
Exactly. So these patients, if they need a CT scan as investigations, they will have the CT scan and the COVID-free CT scanner.
And then what happens if the patient's unfortunate enough, having had the CT scan, and it's showing something which could be a cancer? What happens then to the patient?
We discussed that on the multidisciplinary team, which we have been doing for many years, and then we decide if the patient needs an emergency or urgent operation, that is still happens in a usual way. But if the patient needs a planned operation, then we take 3 things into consideration. One is, what is the stage of the cancer? Number 2 is, we have to take into consideration of acquiring the COVID in case if they have an operation, so that we need to make sure the operation we do is in a very safe environment. And the third one, we make sure that we discuss this with the patient, their age, their fitness, their wishes, so that this is a shared decision making. If they need a planned operation, then we make sure that happens in the safe theatre where there is no COVID patients operated. The second thing is post-operatively we make sure they stay on the safe COVID-free ward for a better recovery of the patient.
Okay, thank you very much,
Thank
Mr.
you.
Ariel.
Thank you.
So from all these interviews, what I'd like to summarise is that in fact the NHS is very much open for business. We are here to try and help you, whether you have COVID problems or non-COVID problems. In fact, all patients who are admitted to hospital now are tested for COVID, whether or not you've come in with symptoms. And this again will help us keep those non-COVID patients safer and freer from disease. We try and minimise the risk to you all the ways we possibly can. So if you have symptoms, if you're not well, please contact your GP or 111. They can be contacted online or via the phone, or if it's an emergency, please phone 999. The NHS is here to help you.